my name is Jessie Peralta. I'm 37 years old. I was a Pussycat doll, and now I just want a pretty pussy.
Tell me what brings you in today.
I had an unmedicated childbirth 3 years ago. I had some tearing on my labia. They tried to sew it up. I could feel the thread being pulled through the skin, but because I didn't have any pain medication, I pretty much wimped out.
You didn't wimp out. I mean, who could have sutures in that area without any numbing medication? I mean, I'm sure that was very challenging and painful.
Okay, I'm not an OBGYN, but why would anybody assume that you can suture a part of their body without that area being numbed up? I mean, this isn't like a post-apocalyptic Walking Dead type of world. Now, I don't know the circumstances surrounding when she gave birth, but the amount of time it takes to load a syringe up with some lidocaine and inject it into an area before you suture it, it's like less than a minute. It's like seconds.
As a woman, you want to feel sexy, and it's just made me very self-conscious. Let's say a hook ripped your cheek in half. Could you still eat? Yeah, I can chew on the other side of my mouth. Can you still smile? Yeah, it looks really crazy. Everything functions well, but it just looks a little crazy. So if you can have it fixed, why not?
There are many reasons why a woman would consider labiaplasty surgery. This is surgery where you remove some of the excess skin or the unwanted skin from the labia minora. Sometimes there's so much extra skin that skin can get pinched, especially when exercising. It can also make intercourse feel very painful too. But we also understand that there is a cosmetic component too. Some people undergo labiaplasty surgery just because they want to cosmetically change the appearance of their labia. But I also need to emphasize that there's no aesthetically perfectly shaped labia. Labia come in all different shapes and sizes, and honestly, it's all normal.
The main concern is this left side tear where it pretty much went all the way down to the bone.
I mean, it's the entire length of your labia.
Yeah,
I can see. Oh my gosh.
Jessie's tears are probably the most extensive I've ever seen. Literally, her labia were almost completely shredded. I mean, there was 3 tears on one side, 2 on the other.
So it sounds like she underwent extensive injury to her labia during this birthing process. So I think you could look at this operation not as being a purely cosmetic surgery, but more of a reconstructive surgery to get her where she was prior to all of this happening.
I drew kind of like a representation so we can go over your anatomy.
This is what your vagina looks like. On this left side, this is where you have like the really deep cut. You'll have to basically bring this together. And then I'm gonna just continue this cut down. You know what I mean? So that way you can sort of see the final result will end up being just this gentle curve. On this side, bring these two together. So that way it'll create the best possible symmetry.
You have your work cut out for you.
I know it's complicated.
Did you see your husband's face? He was like, what is this? I often will draw diagrams of the operation to show the patient. Obviously, it's much more realistic to see it in photographs, but a lot of people don't want to watch an operation where they cut off labial skin. I mean, it is quite graphic in a very personal and private part of the body. So I have to give credit to Dr. Kat for drawing this very simple but very effective illustration of just what she's going to do. Now let's see how the animators of the show Dr. 90210 create the same thing.
For Jessie's labiaplasty, I'm going to reconnect the torn pieces of her right and left labia and refine and shape both sides to make them tucked in and symmetrical.
I'm gonna first start with the very, very deep tear that she has. The tear is so close to the clitoris. I just don't want to put it right here.
Believe it or not, some labiaplasty surgery is performed with the patient completely awake. It is done under a local anesthetic, where the doctor injects a local anesthetic into the labia itself to numb it up, cuts the actual excess labia out, and then sutures it into place. Now, I'm not a woman, but it doesn't sound like that's something that I myself would want to be awake for if I was female. But if you're considering labiaplasty surgery, this is definitely something that you want to talk about with your plastic surgeon prior to actually scheduling it.
All right, Eli, so this is a piece from the right side. Thank you.
During labiaplasty surgery, I use a diagram to show exactly where the pieces came from, and then to show how I should have pieced everything back together, almost like a puzzle.
Here, Eli, here's the big piece from the left. Thank you.
I've always actually looked at certain parts of plastic surgery as putting a puzzle back together. When I get called to the emergency room to see people with facial trauma, dog bites, car accidents, major facial injuries, and their face is kind of splayed open, that's how I look at their face, as this puzzle that I need to put the pieces back into the right place. It's very similar as to what Dr. Kat is doing now with her labia.
This looks incredible. It turned out way better than I expected. She has a really nice, neat, symmetric, and tucked-in shape, just like she wanted.
One of the great things about plastic surgery, and especially labiaplasty surgery like this, is that you can see the results right there. There's something very satisfying about doing an operation and seeing the fruits of your labor right there in front of your eyes at the end of the operation. Now you might be wondering, what type of special glasses is she wearing? And these are called loupes, and they are magnifying glasses where when you look at them, you can actually see everything much more clearly.
Today is officially the 1 month post-surgery mark, and I am celebrating. Yay!
Tell me what's been going on.
A lot of getting it on, I guess, has been going on.
Well, that's a good
Yeah.
thing. Everyone needs that.
Everything is working just like we wanted to, so.
Before, I know you had these like double tears, so I was able to piece all of these little cuts together, and now you look like this.
Really pretty.
I guess that's about as good of a before and after as we're gonna see on network television. Now she's only 1 month out and she's already getting it on. That is a little concerning because it does typically take longer for that, I would think, for it to heal enough to where she could be really, I guess, aggressive with what she's doing in the sheets. So I hope that she follows Dr. Kat's instructions so that she continues to heal really well. There are several more fascinating cases of plastic surgery from Dr. 90210 that I reacted to. Take a peek at this playlist right up here where I react to various episodes of this great show. And if you've been enjoying my videos, please subscribe to my channel, and always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.